Okay, so welcome back to chapter two. We've already established the foundation of how words are built. Now we are going to apply that to the clinical environment. In this chapter, we'll look at specific language used by the specialists you'll be working with every day. A lot of these words you'll continue to see when we go over the different systems and body systems throughout the chapters. So by the end of this particular lecture, you should be able to hear a term in a report or read it in a chart and instantly identify it, the surgical procedure or the specific provider or specialty involved, and possibly the underlying body structure. Oops. So specialists provide the context for medical care. When you see cardio or gastro, you aren't just seeing a root word, you are identifying the department and the nature of the patient's care. So these specialists often overlap in the hospital. For instance, auto, rhino, and laryngeno are frequently grouped together. So learning these combining forms as a cluster to better understand how multidisciplinary teams function and work together. So let's just go back to this as well. Precision is paramount. Note the difference between ist, which is the person, and logy, the study. Using the wrong suffix in your charting changes the meaning of your documentation entirely. So this is a list of terms for medical specialist. You'll continue to see these when we go through the specific body systems. But I have listed them here with the broad definitions for your understanding. But like I said, as we go through the musculoskeletal system, and next week, you'll see these terms repeated. Okay, here's a knowledge check. Once again, the answer is in the note sections, but try to break down the word and figure out what this specialist would be concerned with, what body system. So, these surgical suffixes are the most critical for patient safety. When a physician dictates a note, they aren't describing a general action, they are defining exactly what has been done. So, for instance, a tomy, an incision, is very different from a stomy, which is a formation of an opening, or an ectomy, which is excision, which is a surgical removal of a growth tissue or organ. Pay close attention to these distinctions as they directly impact how you interpret procedures and notes. So, when you see these body structure roots, visualize the organ. So, for instance, when you see hepat or hepato, picture the liver. Associating the root with the actual anatomy is the fastest way to anchor these terms in your memory. And as we go through the different body systems, we'll go over a brief overview of the anatomy. But if you're taking anatomy and physiology, that will reinforce that for you. So keep practicing these body structures. You'll notice that some terms have multiple roots for the same structure, like pulmo, and pneumo. This is common in medical language, possibly because one is from the Greek root and one is from the Latin root. So Think of them as synonyms that you will need to recognize interchangeably in the field. Here's another knowledge check. And then time for a brain break. So during these times, you can get a snack, you can get up and move around. You want to make sure that your brain is taking a respite from taking in all of this information. You want to prevent cognitive overload. Suffixes regarding symptoms and diagnoses tell the story of the patient's condition. Are we describing pain, algia, swelling, edema, or an inflammation, itis? These suffixes provide the what of the patient's complaint. As you learn these, always ask yourself, if I were charting this, what is the most precise patient condition that this patient is experiencing and that I am trying to capture in the charting? So this list includes some of the more complex physiological processes, such as a hemorrhage, a rupture. Understanding this allows you to decode the severity of a patient's situation quickly. We'll talk more about that when we talk about the difference between chronic and acute conditions. So here's another knowledge check for you. So you will encounter exceptions and miscellaneous terms throughout your career. Medical language is a living, evolving system. When you encounter terms that don't necessarily fit the neat Greek or Latin rules, look for the context. Your best resource will always be to cross-reference with these foundational concepts. You will also have tools that you can use in the hospital or healthcare settings, one of them being lexicon, where you can look up these words. It's another knowledge check. This is asking you for the distinction. We will continue to encounter making sure that we understand distinctions between maybe similar sounding words or similarly spelled words, because that's very important to preventing medical errors. And so we've come to the end of chapter 2. Remember, you aren't expected to memorize every single medical term in existence, but you are expected to have the skills to break them down and define them when you encounter them in your professional practice.